mga bakunang ito, makakausap po natin si FDA Director General Yusek Eric Domingo. Doc Eric, good morning po.
Hi, good morning, Yusek Raki.
Opo. Yes, Yusek, sa naging review po ng FDA para mabigyan ng emergency use authorization ng Sputnik V, ano daw po ang mga known at possible risk sa pag-a-administer po ng bakunang ito sa isang tao at ano po yung common side effect na pwedeng maranasan ng mga tatanggap nito?
Yung Sputnik V na vaccine, Yusek Raki, para din siya yung AstraZeneca, isa siyang adenoviral vector vaccine. Ibig sabihin, galing po siya sa virus na hindi nagiging sanhi ng sakit sa tao, tapos linagyan siya ng genetic material ng COVID-19. Pagkatapos yun ang ini-inject sa atin para mag-elicit ng immune response. Maganda yung kanyang efficacy rate, mahigit 91%. Simula po sa bata hanggang sa matanda, medyo pare-pareho, no? Very consistent yung kanyang efficacy rate. At yung nakita naman po sa kanya ng mga side effects or adverse events ay very similar lang po sa mga regular na mga nararamdaman natin kapag tayo nabakunahan ng flu, katulad po ng mga pananakit sa braso, yun po konting yung iba, meron parang tumatamlay ng konti, may konting sinat, or may konting pagbibigat ng katawan, merong iba na magkakaroon ng parang mild sore throat. At syempre po, ang kailangan lang nating bantayan naman dito talaga yung mga may history din po ng allergies, katulad po ng ibang bakuna.
Yusek, may datos ba o reports na mula sa Malaya kung ang Sputnik V daw po ay effective dito sa mga nakikitang bagong variants ng COVID-19?
Well, ongoing pa yung mga studies on the new variant. So, lahat po ng mga vaccines ngayon. Pero ito naman ay mukhang naman pong ang alam naman po natin, habang dumarating ang mga bagong variant, there's a possibility talaga na bababa ng konti ang efficacy ng mga vaccines. At later on, kung nakita naman po ito, maaari naman po kasing i-revise yung mga vaccine para maging mas effective siya with the new variants. So we're still waiting for the data on the new variants.
Ayon po sa report ng The Lancet at ng BBC ay slightly different daw po yung formulation para sa first and second dose ng Sputnik V na gumamit ng magkaibang adenovirus vectors. Mas effective daw po yung ganitong setup para i-boost yung immune system na babakunahan at mas tatagal din daw po yung epekto nito. Totoo po ba daw ito, Dr. Domingo?
So ito yung mga isa sa mga theory kung bakit nga napakataas ng kanyang efficacy rate compared to other adenoviral vaccines na ginagamit. So totoo yun, Yusek Raki, pag binakunahan ka ng first dose mo, ibang adenoviral vector ang laman noon. Pagkatapos after 3 weeks, babakunahan yung tinatawag nating component 2 or second dose, ibang adenoviral vaccine naman, ibang adenoviral vehicle naman yung ginagamit doon. So ang theory is that since magkaiba siya, malakas pa rin yung immune reaction mo doon sa pangalawa, hindi katulad nung hindi siya nadadampen dahil nagkaroon ka na ng previous na exposure. And this is one of the mechanisms being considered kaya bakit mas napakataas niya na mahigit 91% ang kanyang efficacy.
Opo, ayon pa rin nga sa The Lancet, yung 91 and 92% na efficacy rate ng Sputnik V ay naitala mula sa symptomatic cases lang at kailangan po umano daw po ng dagdag na research para malaman kung kaya rin itong pagaling po yung asymptomatic cases. Kung tama ang impormasyon na ito, Yusek, ano po yung instruction ninyo sa vaccination team kapag dumating na po yung bakunang ito sa bansa? At hindi ba siya masasayang sa atin, Yusek, kung karamihan sa kaso natin ay asymptomatic?
Well, hindi naman po. Lahat ng vaccines ngayon talaga kasi kulang pa yung pag-aaral natin sa mga asymptomatic cases at saka yung transmission. Ang alam natin, nababawasan yung pagkakaroon mo ng sakit, pero hindi natin alam kung nababawasan yung kung ikaw ay nagkasakit na asymptomatic ka, kung nakakapag-transmit ka. So these are part of the ongoing studies right now ng lahat po ng mga bakuna. Pero of course, ang importante talaga during the time of vaccination is very thorough yung screening natin sa ating mga pasyente na babakunahan. Yung kanilang medical history, yung kanilang kung nagkaroon sila ng symptoms in the past few days, At lalo-lalo na yung actual, no, panahon na pagdating nila, kailangan malaman natin kung wala siyang sakit, na wala siyang lagnat, na walang nararamdaman, na mataas ang na normal ang blood pressure, at kung may mga sakit siya katulad ng diabetes, ay dapat kontrolado ito bago natin bakunahan.
Dahil sinasabing mataas nga po yung efficacy rate nito para sa adults na may edad 18 years old and above, maire-recommenda ba ng FDA ang Sputnik V sa mga senior citizen po regardless kung sila ay may healthy condition o may comorbidities?
Well, yun po ang atin pong indication for Sputnik V would include adults 18 years old and above. Ang maganda naman po kung mababasa natin yung kanyang article sa Lancet, more than 10% or about 10% of their clinical trial participants talaga pong senior citizen, no? So medyo malaking parte po ng kanilang study, mahigit 2,000 ay mga senior citizen, at yung senior citizen na yun nakita na maganda rin ang safety at saka yung efficacy sa kanila ay mataas din katulad ng mga bata. Pagkatapos po, kung titingnan din natin yung kanilang pag-aaral sa Lancet, 25% ng kanilang mga participants may mga comorbidities, no? May mga diabetic, may mga high blood, at napakita nila na maganda rin ang resulta sa mga ito. So mas wide po ang kanyang indication at mas marami pong taong maaaring paggamitan ng bakuna.
Sinabi nyo nga po na hindi pwede iturok sa mga senior citizen ang Sinovac vaccines. Ito po ay matapos sabihin ni Vaccine SAR Secretary Galvez na 9 milyong nakakatandang Pilipino po ang bibigyan ng naturang bakuna sa susunod na buwan. Sumunod naman po ba sila Secretary Galvez sa desisyon na, ninyo na yan na hindi po matutuloy yung balak nilang yon, Yusek?
Well, so far po wala pa naman po yatang plano na mag-roll out ng Sinovac sa senior citizen. Hindi naman po natin kasi sinabi na bawal o na makasasama ito. Ang atin lang pong impormasyon na binigay ay wala pa pong datos na nagsasabi na maganda rin ito sa mga 60 years old and above. Just because wala pong kasamang ganun sa clinical trial phase 3 ng Sinovac. So siguro po once naman nagbigay ng data ang ating manufacturer at mapakita nila na maganda rin ang resulta, sa ganito, madali naman po nating maisama yung grupo na yon or ma-revise yung EUA. Pero as of now, wala pa po kasi talaga tayong data on 60-year-olds and above.
Opo, tungkol naman dun sa naging panawagan ni Senate President Vicente Soto III na dapat daw po ay mag-focus ang pamahalaan sa treatment ng COVID-19 cases. Sa gitnaan niya ng umano'y vaccine delays, nagbanggit siya ng mga endorsed medication na maaari niyang pagtuunan ng pansin gaya daw po ng Avigan at Remdesivir. Ito po ba ay may rekomenda rin ng FDA sa ongoing medication ng mga may active COVID cases?
Yung Avigan po, meron tayong ongoing yan na clinical trial, ang DOH at saka PGH. At available po yan sa mga mild to moderate na meron pong mga COVID, no, na nasa ospital. Yung Remdesivir naman po ay ginagamit natin sa mga severe, no, na mga COVID na mga naka-admit. At tuloy-tuloy po ang pagbibigay ng FDA ng Compassionate Special Permit sa mga ospital para ma-import po ito at magamit sa mga pasyente. So ito po dalawang gamot na to ay talagang kasama po yan doon sa mga clinical treatment guidelines po ng Philippine Society for Microbiology and Infectious Disease. Kaya sa ngayon po ay nagagamit sila dito sa atin.
Opo, Yusek, muntahan natin yung tanong mula sa media mula kay Red Mendoza ng Manila Times. Sinasabi po ng private sector na dapat payagan sila daw mag-acquire ng bakuna para sa kanilang mga empleyado. Hindi ba nila malalabag yung provisions ng EUA?
Hindi naman po, basta hindi lamang po didiretso, kailangan may koordinasyon sa Department of Health para sigurado tayo na nasusunod yung ating pong mga guidelines po ng ating vaccination program at saka yung prioritization po natin ay hindi po na bypass, no? So maaari naman pong maging partners ng pamahalaan ng private sector, but they have to coordinate with the Department of Health.
Tanong pa rin po ni Red Mendoza ng Manila Times, pagkatapos po madiskubre ang issue sa mababang sensitivity ng dalawang antigen test na SD Biosensor at Lumi Quick Test, mababago na po ba daw yung proseso ng pag-approve sa mga ito? Dapat na po bang mauna yung evaluation ng RITM bago po yung approval ng FDA?
Opo, so yun po yung ginagawa namin ngayon na ano, no, nilalabas namin na bagong issuance kasi nga marami na rin naman pong kits na available. So yung mga kits na nandito na ay kailangan pumasa sila doon sa kanilang RITM evaluation para maituloy nila ang pagbibenta ng kits. Pagkatapos naman yung mga darating pa po ng mga bagong mag-a-apply, kailangan na po ng RITM evaluation bago po natin i-apply.
Opo. Yusek, may tanong po si Maricel Halili ng TV5. May mga gumagamit daw po ng ivermectin kahit walang endorsement ng FDA. Please reiterate daw po your advice to the public. How effective or how risky is this?
Yung ivermectin po kasi, isa siya sa mga talagang, may mga clinical trials po no, to see the effect of ivermectin in the treatment and prevention of COVID-19. Kaya lang sa ngayon po, lahat ng mga clinical trial ay wala pa pong nagpapakita ng magandang ebidensya na para sabihin na nakakatulong siya. Wala pa po tayong nakikitang benefit sa gamot na to. Kaya hindi pa po natin siya ma-advise na panggamot for COVID-19. Pangalawa, sa Pilipinas po kasi, ang mga registered lamang na tableta o oral medicines for ivermectin ay para sa mga hayop. Wala pong human na ivermectin na oral preparations na registered at approved dito sa Pilipinas. Kaya binabalaan po namin na huwag po tayong iinom ng gamot na para sa mga hayop kasi iba po ang dosage niyan, iba po ang quality niyan at hindi po tayo nakasisigurado na ito ay aakma sa tao lalo na po pag maling dose o mali po yung ating nainom.
Opo. Tanong naman ni Joseph Morong ng GMA News, would you recommend then yung Sputnik V sa mga seniors who are next in line daw po sa vaccination? Ibig sabihin nito na gamitin for seniors after natin ma-finish yung healthcare workers. When do you think we can do that?
Opo, so yung pong ito pong Sputnik V, pwede po yung gamitin sa seniors kasi mas AstraZeneca at saka yung Pfizer. Kasi po itong tatlong ito, kung babasahin po natin yung mga published clinical trial results, makikita naman po natin na a certain portion of their subjects included elderly. Hopefully po, ang plano po na nalaman ko ng ating pamahalaan na makapag-umpisa na sa mga senior citizens ay by April. Yun po ang naririnig ko kay Secretary Charlie na by March ay tatapusin po yung mga healthcare workers para by April sa mga senior citizens na po tayo.
Opo, may tanong naman si Sam Medenilla ng Business Mirror. May update na po kaya regarding sa application for the EUA of the COVID-19 vaccine ng Sinopharm?
Well, wala pa pong update. Meron na pong dalawa. Dalawa na po ngayong kumpanya yung sumulat dito sa amin at sinasabi nga na sila daw ang mag-a-apply for the Sinopharm. Sinulatan naman po namin sila para magbigay ng listahan po ng mga requirements at ng mga documents na kailangan i-submit. Pero so far, wala pa naman pong sagot pareho. So wala pa po kaming ine-evaluate ngayon na application for EUA ng Sinopharm.
Okay, may tanong pa rin po si Rose Noben. Sandali lang po, Yusek, may bigla lang pong nagpahabol na tanong. May tanong po si Rose Nobenario ng Hataw, may plano ba ang DOH na humingi ng saklolo sa Cuba considering maraming bansa na silang natulungan para mapababa ang kaso ng COVID-19?
Well, wala naman po akong narinig pa na galing sa Department of Health na plano na makipag-ugnayan sa ibang bansa as of now po para dito sa COVID-19. Although hindi ko naman po masisigurado dahil medyo malayo po ang opisina ko sa DOH.
Okay, maraming salamat po sa inyong panahon. FDA Director General Yusek Eric Domingo. Mabuhay po kayo, Yusek.
Thank you. Maraming salamat din po.
Opo, vaccine confidence ang isa sa nakikita pong posibleng dahilan ng World Health Organization sa biglang pagdami po ng mga kaso ng COVID-19 na naitatala dito sa bansa araw-araw. Asahan ba natin ang pagsipa pa ng numero ng mga nahahawa sa sakit ngayon, dumarami rin po ang bakunang dumarating sa Pilipinas. Para pag-usapan yan, we are joined by the WHO representative to the Philippines, Dr. Rabi Abenyasing. Good morning, Dr. Rabi.
Good morning, Yusek Raki. Good to be here.
Doc Rabi, can you tell us what vaccine confidence means and how it could possibly be the cause of the sudden surge of COVID-19 cases in the Philippines?
Um, it's not vaccine confidence, it's vaccine optimism, probably, that is responsible to some extent to an increase of COVID cases, not only here in the Philippines, but in other countries also where we are seeing an increase. The interpretation is that with the arrival of vaccines, uh, people started relaxing their protocol compliance, so the public health behaviors. There was a tendency, not largely, but in small measure, to go out more frequently, to meet more frequently with other people. Of course, this was partly because of the long quarantine periods and the long lockdowns that people have undergone. And so, with the arrival of vaccines in many countries, there was an optimism that people can go back quickly to the way they lived life before the pandemic. And these little changes in compliance with the protocols is believed to have caused um, opportunity for the virus to transmit more freely, and that could have been one of the causes why we are seeing increased transmission here in the Philippines also.
Dr. Rabi, has the same scenario been observed in other countries that has started their vaccine rollout?
Yes, so we are seeing right now a global increase in cases. Our Director General mentioned that this on Friday, that last week was the fourth consecutive week we are seeing a week-on-week increase of the number of cases reported globally. So after a stabilization of transmission in January and early February, we have seen now that globally in several countries we are seeing an increase of transmission. And the thinking is that this could be related to vaccine optimism and the arrival of vaccines, and not following the protocols and the physical distancing as before the vaccines arrived. But it could also be to some extent linked to circulation of new variants that are thought to have increased transmissibility. So the mix of these factors could actually be causing higher levels of transmission in the Philippines also.
Dr. Rabi, now that the FDA gave the green light to the Sputnik V vaccine from Russia, is this vaccine already included to the WHO's emergency use listing? If so, could the Philippines possibly get this from the COVAX facility on top of the AstraZeneca and Pfizer vaccines?
Unfortunately, the Sputnik V vaccine is not part of the WHO EUL process yet. It is a vaccine that is being considered by WHO for EUL listing because of its reported high efficacy, but the process is not yet complete, and so it cannot be included in the COVAX folder of vaccines until WHO grants emergency use listing status for the Sputnik V.
Dr. Rabi, with the issue circulating around the AstraZeneca vaccine that was suspected to have caused blood clotting in many countries in Europe has temporarily suspended its administration, while some continue despite this concern. Although WHO already mentioned that there is no evident link between the vaccine and the blood clot, is the WHO at least conducting further investigation on this matter to ease distrust and discomfort to this vaccine?
So there was some concern that there was a relationship between a few episodes of thromboembolic disease or blood clotting which had been observed in some countries of Europe. But we are happy to state that the European Medical Association, after a careful evaluation of all the data, has agreed with WHO's position that there doesn't seem a causal link with the AstraZeneca vaccine and the frequency of thromboembolic episodes that have been reported in the population. The number of thromboembolic episodes that have been reported in the vaccinated population was, according to some reports, lower than in the normal population. So there is no causal link established. And so we are conscious of the fact that there were about 40 cases of such disease episodes reported in Europe. But this is in comparison to almost 50 million doses of AstraZeneca that have been administered, nearly 20 million in Europe and about 30 million in other parts of the world. And these reports have not been seen anywhere. So based on this fact, WHO and now the European Medical Association reiterates that there is no link and it is safe to use the vaccines. Of course, recognizing that these are emergency use listed vaccines, WHO and the European Medical Association continue to say that national authorities need to monitor carefully for side effects, and we encourage countries using AstraZeneca vaccine to do that. The current position is that there is no evidence that the vaccines actually are causing those episodes, and therefore the usefulness of using the vaccine far outweigh these few sporadic cases that have been reported to WHO. So while advocating that countries continue to monitor for thromboembolic disease and other side effects, the consensus now is both from WHO and the European Medical Association that the AstraZeneca vaccines are safe for use. And based on this decision that came on Thursday from the EMA and Friday from WHO's Global Vaccine Advisory Committee on Vaccine Safety, many of the European countries that had a temporary halt on the use of AstraZeneca have restarted using them, and the AstraZeneca vaccines are now being used all over the world.
Dr. Rabi, do you agree with the government's move to administer the remaining AstraZeneca vaccine and stock as the first dose for health workers in areas with high cases of COVID-19?
So as the number of cases increase, it becomes critically important that we take steps to reduce that transmission, but also as part of that we ensure that the healthcare capacities are fully functional. Of course, it was with this view that originally the frontline healthcare workers were included in priority group 1, and now that we are seeing a surge of cases in the National Capital Region and adjoining regions, it becomes even more important that we protect the healthcare workers by the use of vaccines. So we are trying to maximize the benefit of the vaccines we have by vaccinating the frontline health workers as quickly as possible, targeting specifically those areas that we are seeing an increase of transmission. We know that with one dose of vaccine, there is protection of over 75%. And so it's important that we provide that protection to the healthcare workers so that they can continue to care for those people who fall sick from COVID in those areas of increased transmission. So this is quite aligned to what WHO, SAGE and WHO has been advocating, and we are happy that the Philippines is following this strategy. Thank you.
Dr. Rabi, what if the additional AstraZeneca vaccine did not arrive as planned in time for the health workers' second dose? Will this affect the efficacy of the vaccine?
The second dose is scheduled to be given after 8 weeks around and could be given up to 12 weeks. The evidence that is available globally shows that the maximum benefit of the second dose can be achieved by administering the dose after the 10th week and around the 12th week. So we believe that new stocks of AstraZeneca vaccine will arrive before the 12th week. 12 weeks from the arrival of vaccines on the 4th of March will be in June, and we believe that the country will receive further stocks of AstraZeneca before that, so that we can ensure that all those people, healthcare workers who receive the first dose, will be able to get their second dose before the 12th week or around that time.
Dr. Rabi, let's now proceed to the question from the media. We have here from Laila Salaveria. What does the WHO think of proposals to exclude PVT entities, such as those in the manufacture of tobacco, alcohol, milk, and soda, from procuring their own COVID vaccines? What effect could such a policy, if enforced, have on efforts to immunize the population?
The concern with those sectors procuring and distributing vaccines was that that could be used as advocacy for those products and could be interpreted from that light. So under the Framework Convention for Tobacco Control, which the Philippines has signed, there are limitations on providing opportunities for those industries to be providing health-related services or using health-related services for marketing advocacy. It's in line with this. We believe that the Department of Health does not encourage those industries to be involved in the distribution of vaccines. Of course, their workers will be entitled to vaccines through the national vaccine rollout. And so we don't believe that they will be left behind as the vaccine rollout happens.
We have another questions from Red Mendoza of Manila Times. Former National Task Force Advisor Dr. Tony Liachon criticized your statement in our previous conference, where you said that vaccine optimism was the reason why cases have increased in the country, stressing that the ultimate blame for the increase of cases in the country was the slow response of the government. What can you say about this?
Well, the fundamental reason is why are we seeing an increase, and as I mentioned the last time, this increase is not limited to the Philippines. We are seeing an increase in many countries, including in countries that have been rolling out vaccines rather successfully. So it's something larger than the slow response. The slow response could be attributed to increasing cases continuing, but the fundamental reason that actually contributed to an increase in cases is rather more likely to be linked to the factors I already mentioned.
Another question from Red Mendoza. With more than 21,000 cases posted in the past 3 days, is this a cause for alarm for the government to strengthen its response? Do you think the current measures that were imposed on Sunday are enough?
There are two aspects that need to be looked at. Clearly, the compliance with the minimum public health standards need to be reinforced, and those measures that were announced on Sunday will go a long distance to do that. But if we also assume that this transmission is in some way linked to the circulation of new variants who are reported to have increased transmissibility, it becomes increasingly important that at a local government level, we expedite the case detection, testing, the contact tracing, the quarantining and isolation of infected people and exposed people, close contacts. This aspect of the response is something that has suffered through the year because, as I've mentioned before, the implementation has been different across different local government units. So this is again an opportunity to reinforce and ensure that those measures are strengthened in addition to the non-pharmaceutical measures or the minimum public health standard that are being strengthened through the resolution of the IATA.
Dr. Rabi, a question from Joseph Morong of GMA News. If you analyze the present situation in the Philippines, what are the areas of improvement in the government's response to the pandemic?
So, as I already mentioned, the need to strengthen the rapid testing and strengthening the contact tracing and management, the identification of sources of infection. Where is the transmission actually happening? Is it limited to social gatherings in families or among friends? Is it also being driven by gatherings at work sites, in dormitories? This kind of investigation at local government level is critically important so that we identify those mass amplifying events and do everything possible to minimize the occurrence and the repeat occurrence of such situations. So this is an area that we have not been able to strengthen over the last few months, and maybe this is an opportunity for us to focus on that and identify those settings where we see transmission happening and to share that information with the public so that the public can avoid those places and protect themselves more effectively.
From Sami Danilla of Business Mirror, has the WHO already conducted a study on the P3 variant of COVID-19, which was first detected in the Philippines? If yes, it is more infectious than the usual kind of COVID-19.
So the P3 variant appears to be linked to the P1 variant, which originally was reported from Manaus in Brazil, but with some further mutations. Now, the question is the P3 variant associated with increased transmissibility or increased severity of disease? WHO here in the Philippines and in other countries where the P3 variant has been confirmed is working with national authorities, including here in the DOH and the Philippine Genome Center. We are trying to understand the number of confirmed cases of P3 variants, what are their clinical symptoms, how many close contacts of them have been infected, because all this information will help us to come up with a hypothesis whether the P3 variant is actually linked to increased transmissibility or causing more severe disease. So this is an ongoing process. I would like to remind you that the B117 variant, which was originally detected in the UK in September last year, is still being analyzed, and we are trying to understand. So this process takes a long time. The P3 variant was confirmed only in early March, late February. So this is going to take a few more weeks or months to understand the epidemiological significance of the P3 variant and whether it is actually linked to increased transmissibility or severity of disease.
Dr. Rabi from Joseph Morong, how soon do you think should the Philippines ramp up a vaccination to start the rise in COVID cases and to stem the rise in COVID cases? And can the Philippines use Sputnik V for the senior citizens?
So vaccination is a critical component of the COVID response. We have repeatedly been saying that we want access to vaccines, equitable access to vaccines across the world, and especially more so in countries that are seeing an increase in transmission, because the impact of the vaccines will be far more marked if we can have populations in those places that are seeing increased transmission vaccinated. So in line with this, we are very much supportive of the Philippine government's efforts to access vaccines and provide protection to the population. This is, of course, in addition to the minimum public health standards that need to be reinforced. What we know is that if we can provide vaccines, particularly to the frontliners and the healthcare workers, we will see a marked decrease in severe COVID and a decrease in deaths. And this is our immediate aim. This is what we need to aim for now as we strengthen the minimum public health standards aimed at reducing transmission. So if we can access vaccines and provide them to the priority groups, we could expect to see that impact early on. So we encourage the Philippines to access vaccines as early as possible, and we certainly are working with the CoVaccine facility to expedite deliveries to the Philippines. With regards to the Sputnik V vaccine and whether they are suitable for elderly populations, I go back to the fact that this vaccine has not been completely evaluated by WHO at this point of time, and therefore I would refrain from commenting on that.
Thank you very much for your time, Dr. Rabi Abengyasing, WHO representative to the Philippines. Thank you very much. Maraming salamat po.
Thank you so much. Have a good day.
Samantala, nasa 1,600 na po nakatao na sa lanta ng mga bagyo nung nakaraang taon sa lalawigan ng Isabela ang binalikan at muling hinatiran ng tulong ng pamahalaan at ni Senator Bongo. Kasama rin po yung nasa 500 medical frontliners at mga pasyente sa isang ospital sa probinsya. Narito po ang report.
Sunod-sunod na dagok sa buhay ang naranasan ni Irene Val ng Kawayan, Isabela. Kasagsagan ng COVID-19 pandemic ng mga anak at sa kalagayan niya bilang person with disability, hindi lang sa panganganak na hirapan kundi sa sitwasyon dahil sa virus. Kamakailan lang na aksidente pa ang mister niya na tricycle driver kaya hindi makakabiyahe.
May anak po akong baby, 10 months old po, na naggagatas po siya. Hindi ko po alam kung saan ko kukunin yung panggatas niya, sir, at yung sa araw-araw namin. Tapos magbayad po namin ng kuryente. Malaki po yung problema namin kasi pinapabayaran po kami ng babae ng 22K. Saan po kami kukuha nun? Mahirap lang po kami. Kahit na po 1,000, mahirap nang hanapin. Lalo na po yun.
Pumunta siya ng City Hall para i-follow up ang kuha ng CCTV sa pag-aaksidente ng asawa nang tiyempong namahagi ng ayuda ang tanggapan ni Senador Go at kabilang siya sa nabigyan.
Masayang-masaya po kasi hindi ko po akalain na mabibigyan po ako kasi ang sadya ko po talaga dito, si Vice Mayor po, kakausapin ko lang po about sa CCTV para malaman po kung ano po yung totoong nangyari sa asawa ko.
Nitong nakaraang linggo, binalikan ni Senador Christopher Bongo ang Ilagan, Isabela para ituloy ang pamamahagi ng ayuda sa mga nabiktima pa ng bagyo at pagbaha noong nakaraang taon. Abot sa 1,600 na mga benepisyaryo ang inabutan nito ng mga pagkain, grocery, vitamins, mask at face shield, sapatos, bike at tablets. Bukod sa Kawayan City, nag-ikot din ang kanyang outreach team sa mga bayan ng Santa Maria, San Pablo at Santo Tomas para mamahagi ng tulong sa mga naapektuhan ng kalamidad.
Nakatanggap po kami ngayon ng 3,000 pesos kasama po yung mga vitamin C, mga face shield, saka face mask. Nagpapasalamat po kami sa Pangulong Duterte, kasama po si Senator Bongo, kasama din po lahat ng staff ni Senator Bongo.
Personal ding binisita ni Senador Go ang Malasakit Center at ang mga medical frontliners sa Governor Faustino D. Sr. Memorial Hospital para pasalamatan sila sa patuloy na paglaban sa COVID-19. Abot sa 500 mga medical frontliners at mga mahihirap na pasyente ang inabutan ng tulong.
Ngayon lang nagkaroon ng ganito na isang napakahalaga, napakalaking bagay para sa ating mga kababayan. Kasi lahat ng mga nagkakasakit na walang-wala, natutulungan niya. No? Kay Senator Bongo, maraming salamat. No? Siyempre sa ating presidente. No?
Bilang isang frontliner, napakahirap po para sa amin na labanan ang hindi po namin nakikitang sakit. Kaya po kaming mga frontliners ay nagpapasalamat kay Pangulong Rodrigo Duterte para kami prioritize sa vaccine na to. Kami po nabakunahan last week ng Sinovac po.
Samantala, isa sa ilalim sa General Community Quarantine ng buong National Capital Region kasama ang mga karatig lalawigan ng Bulacan, Cavite, Laguna at Rizal na tatawagin bilang NCR Plus sa loob ng 2 linggo. Magsisimula ito ngayong araw, March 22, 2021 hanggang April 4, 2021. Yan po ay base sa pinakahuling resolusyon na inilabas ng Interagency Task Force Against COVID-19 kahapon bilang tugon sa patuloy na paglobo po ng mga kaso ng COVID-19 sa bansa. Dahil dito magiging isang travel bubble sa loob ng 2 linggo ang NCR Plus. Ibig sabihin po, hindi pwedeng pumasok at lumabas mula sa travel bubble na ito ang mga may non-essential travel. Tanging ang mga authorized persons outside of residence o upper lang po ang papayagan. Magpapatupad din po ng 10 p.m. to 5 a.m. common curfew sa buong NCR, Bulacan, Cavite, Laguna at Rizal. Para malaman ang mga karagdagang detalye sa bagong paghihigpit na gagawin sa mga apektadong lugar na yan, makakausap po natin si DILG spokesperson Undersecretary Jonathan Malaya. Good morning po, Yusek.
Yes, magandang umaga, Yusek Rocky.
Yusek, kahapon nga po inanunsyo na yung pagkakaroon ng GCQ bubble sa NCR at 4 na probinsya na nakapalibot dito. At ang highlight dito ay yung pagkontrol sa galaw ng mga tao. Unahin muna natin, sino lang po daw ang papayagan lumabas ng bahay?
Opo, Yusek Rocky, ang dahilan po nitong paghihigpit natin ay para nga po hindi na pumalat pa ang COVID-19. So gumawa po ang ating pamahalaan ng tinatawag na travel bubble o itong NCR plus neighboring provinces o yung matatawag po nating Mega Manila area. So hindi muna po makakalabas for 2 weeks or makakapasok ang mga taong walang essential travel except yung mga essential workers na makapagpapakita ng ID nila na sila ay kailangan gumalaw dahil sa trabaho, yung mga health and emergency frontline services personnel, mga taong gobyerno na may essential na ginagawa, mga kumpanya na humanitarian ang ginagawa, persons traveling for medical or humanitarian reasons, yung mga papunta po sa airport para bumiyahe papunta sa labas ng bansa, and yung mga pauwi sa Metro Manila galing sa isang leisure activity. And of course, yung mga returning overseas Filipinos and overseas Filipino workers. So, dilinawin ko po, lahat po ng hindi pasok dito sa pamantayang ito, gaya ng lalabas para sa leisure or lalabas para sa travel and tourism purposes, ay hindi po pinapahintulutan ngayon, hindi po kayo papayagang lumabas sa mga checkpoints at hindi rin po kayo makakalabas sa ating mga airports and seaports as well.
Opo. Magse-set up po ba ulit ng mga checkpoints kada barangay o kada kalsada para po tiyaking walang makakalusot na hindi authorized person outside residence? At ano lang po yung need na ipakita ng mga lalabas ng kanilang mga bahay?
Hindi po tayo maglalagay ng mga checkpoints sa mga barangay o sa loob ng Metro Manila for purposes of the travel bubble. Ang mga checkpoints po natin, Yusek, ay nasa mga boundaries ng Bulacan papuntang Pampanga, sa boundary ng Rizal papunta sa mga karatig probinsya, sa boundary ng Cavite and Batangas, at yung mga boundaries ng Laguna papunta naman sa Quezon. No? So, nandyan po mga 20 po yan na tinatawag nating quarantine control points. Kagabi po ng alas 12 ng ating gabi ay nakapag-set up na ang ating Joint Task Force COVID Shield sa pangunguna ni General Cesar Hosorn Binag. No? Yung mga checkpoints pong ilinalagay natin sa Metro Manila ay hindi for purposes of the travel bubble, yun po ay for purposes of the curfew restrictions natin. Nagtalaga po tayo ng mga 10,000 kapulisan sa buong Metro Manila at karatig lugar para po ma-implement ng maayos yung ating curfew na nagsisimula ng alas 10 hanggang alas 5 ng madaling araw.
Opo, sabi po sa resolusyon, senior citizens daw po are allowed kung may importanteng gawain, katulad po na mag-exercise at mag-engage po sa non-contact sports. May limit ba yung layo na pupuntahan nilang lugar? How do we enforce na hindi po maaabuso itong exemption na ito?
Opo, pwede nga pong lumabas para mag-exercise ang ating mga senior citizens or kaya naman bumili ng pagkain or bumili ng mga gamot sa Mercury Drug, for example, o sa mga butika natin. Ngunit doon po sa mga outdoor exercises, kailangan malapit lang po sa kanilang tinitirhan. Kasi po it will defeat the purpose of itong ating gagawin kung sasabihin natin na yung taga Las Piñas ay dadayo pa ng Luneta o yung mga taga Parañaque ay dadayo pa ng UP campus para mag-exercise lamang. Doon po tayo mag-exercise sa mga malalapit na lugar sa atin, no? Na open air. Doon po tayo mag-exercise. Kung kayo po ay nakatira sa subdivision, doon sa inyong clubhouse or any open area. Kung kayo naman po ay hindi nakatira sa subdivision, kahit po saang lugar, pero wag na po tayong dumayo pa sa kabilang bayan para lang po mag-exercise because it will defeat the very purpose of yung ating stay-at-home policy.
Opo, paano daw po yung nasa public transport? Iisa-isahin ba ulit yung route purpose ng travel nila kapag dumaan sa border?
Opo, for purposes of implementing the travel bubble, lahat po ng papasok at palabas ng Metro Manila na nakasakay sa mga pribado or pampublikong sasakyan ay i-inspekin po yan ng ating kapulisan. So maghanda na po tayo ng mga ebidensya na tayo ay pasok doon sa IATF Resolution number 104. Ipakita po natin sa mga pulis na ang ginagawa natin ay essential work or essential function. So pwede pong pababain ang lahat ng nakasakay sa mga public transportation. Yun naman pong mga nakasakay sa pribadong sasakyan ay kailangan lamang buksan ng kanilang mga bintana at isumite sa ating kapulisan yung ating mga dokumento magpapatunay na ang ginagawa natin ay essential at hindi leisure or tourism purposes.
Opo, Yusek, unahin ko na itong tanong ni Pia Gutierrez ng ABS-CBN. Ano po, LGUs outside the bubble have implemented their own versions of quarantines. Example daw po, Pampanga has imposed house quarantine province-wide. Is this allowed? Hindi ba dapat may approval ito ng IATF?
Okay, hindi pa po maliwanag sa akin, Yusek, kung anong ibig sabihin ng house quarantine ng Pampanga. No? I would need more details about that. Pero kung ang sinasabi lang ng Pampanga ay yung kanilang yung mga kabataan, no, yung 18 and below and 65 and above have to stay at home, ay wala naman po ako nakikitang problema dyan because that would be consistent with the IATF Resolution 104. Ngunit kung pinagbabawal na po lahat ng tao na lumabas at makapagtrabaho o kaya naman ay mag-access ng essential services o kaya naman gumawa ng isang bagay na with relation to livelihood or work, ay yan po ay hindi po yan consistent sa IATF resolution, and we would request the Pampanga provincial government to withdraw that policy.
Tanong po ni Bea Bernardo ng PTV, ang non-essential travel po ba like a staycation within the NCR Plus bubble ay papayagan o hindi?
Okay. Pwede po yung mga staycation within Metro Manila dahil nga po ngayong Holy Week, no? Marami na pong nagplanong lumabas, ngunit dahil nga po dito sa ating imposition of the travel bubble, hindi na po kayo makakalabas. Ngunit, remember, meron po tayong prohibition on any form of mass gathering. Ibig pong sabihin, kung mag-staycation po kayo, kayo lang pong immediate family. Kasi po, let me give an example, Yusek. Lalabas ng Metro Manila, pupunta ng Laguna. Allowed yun because we are one contiguous area, NCR+. Pero 30 naman kayo at pupunta kayo sa Calamba para mag-swimming doon sa mga, or sa Los Baños para mag-swimming or sa Pansol, no? Pinagbabawal po yan. Hindi po yan pwede. No? It must only be your immediate family. Dahil hindi nga, pinagbabawal nga po ng mahigpit yung public or mass gathering. Especially po yung mga indoor gatherings, Yusek. Kasi di ba kita natin, ang hawaan ngayon, household level. So any form of indoor gatherings, especially yung more than 10, ay ipinagbabawal po natin.
Opo. Question from Jackie Madabat ng ABS-CBN, what is the protocol if a passenger daw po tests positive for COVID-19 at a transport hub, RT-PCR and antigen?
Okay, hindi po maliwanag sa akin yung tanong kasi if this relates to travel to a province for tourism purposes, pinagbabawal na nga po natin yan. Ngunit kung meron pong apor na pumunta sa isang probinsya and the province requires RT-PCR test, kung negative po siya at wala po siyang sintomas, papapasukin po siya ng probinsya. Ngunit kung siya po ay nag-positive sa antigen or sa RT-PCR test, he will have to be quarantined by the LGU of destination. So, doon na po siya muna magka-quarantine hanggang gumaling siya doon sa LGU na kanyang pinuntahan.
Mula pa rin po kay Jackie Manabat, some of those who tested antigen positive were asked daw po by some barangays to take the taxi from the airport. Allowed ba to? At if yes, bakit daw po?
Yusek Rocky, saang nangyari ito? No? Kasi this may be Metro Manila, this may be Cebu, this may be Davao. So, I'd like just to ask Jackie for additional information para mas masagot ko ng tama yung tanong. Kasi nag-iba-iba na kasi yung rules natin for Metro Manila at iba naman yung pulisiya natin outside of the Greater Manila area.
Opo. Tanong pa rin po ni Jackie Manabat, who will determine daw po if the travel is essential and non-essential?
Well, unang-una, the person himself, no? You will know if your travel is essential because if you are doing it for purposes of work, no, you are an architect and or you are a logistics handler and you have to leave Manila para maghatid ng mga goods, no? Isa kang agriculture, you're related to delivery of food into and outside of Metro Manila, no? You are working for Mercury Drug and you are delivering drugs outside of Metro Manila or to Metro Manila. Lahat po yan essential because those are work-related. Pero kung uuwi po tayo sa ating mga probinsya para magbakasyon, that is not work. That is not essential work. That is leisure and that is already travel and tourism. So it will be you at the beginning, but if you will insist, it will now be the airlines for those flying outside of the country or the agencies of government at our airports. It will be the seaports, yung ating mga the different sea companies, no, travel companies for sea travel, and it will also be the police officers manning the checkpoints who will determine if you are undertaking essential travel.
Opo. From Raymond Tinasa ng Bombo Radio, kung bubble GCQ ang NCR, Rizal, Laguna, Bulacan at Cavite, meaning pwedeng makabiyahe, walang travel restriction within sa bubble area, except kung lalabas sila sa Batangas and Pampanga?
Yes, tama po yan. But Yusek, it has to be read in conjunction with the prohibition or encouraging the public to stay at home. Kasi unang-una, there's a variant spreading in Metro Manila. At ayaw natin ng super spreader events na magpapataas pa ng 7,500 to baka umabot pa ng 9,000, baka abot pa ng 10,000 yan. So, we urge the public, as mentioned in the IATF resolution, na wag na po tayong gumala ng gumala. Although technically, allowed po yan, USEC, because wala naman tayong border controls between Metro Manila and Laguna and Cavite and Bulacan. However, we highly discourage it. Stay at home muna po tayo. In fact, we discourage even visiting family members who are not part of your immediate family. Stay muna po tayo sa ating mga bahay. Tulungan niyo po ang pamahalaan para mapababa natin itong surge na ito. Dahil pag hindi na po makayanan ng ating healthcare system, itong numero ng mga COVID positives natin, baka po magka-hard lockdown na tayo. At ayaw po nating mangyarihan hard lockdown dahil ang dami na pong mga Pilipino ang naghihirap at naapektuhan nitong pandemyang ito.
Opo, tanong ni Samed Danilia ng Business Mirror, pinopropose na po ni Mayor Magalong ang pagtap sa mga PNP personnel para po makatulong sa contact tracing efforts ng government. May response na po kaya ang DILG and PNP regarding sa nasabing proposal?
Opo, USEC from the very beginning kasama naman talaga ang PNP sa ating contact tracing teams. Yung una nating mga contact tracing teams na inorganisa noong Marso ay nandun ang PNP kasama ang BFP. Of course, yung Local Government Unit Epidemiology Unit, no? And of course, yung ating mga Barangay Health Emergency Response Teams. Ngunit, dahil nga po sa paglobo ng mga kaso dahil sa surge na ito, ay nung nakaraang linggo, ay nagtalaga ng almost 400 additional contact tracers ang ating kapulisan. At ito po ay dineploy physically sa lahat ng local government units sa buong Metro Manila. Meron din pong karagdagang 100 mula naman sa Bureau of Fire Protection. Ang 60 po ng mga bombero natin ay na-deploy sa Quezon City, yung 40 naman po na-deploy sa Pasay. At meron din pong karagdagang 300 mula sa Metro Manila Development Authority. So sa tingin po namin, ito pong mga numerong ito ngayon ay sapat, ngunit nakikipag-ugnayan pa po kami sa mga LGUs kung meron pa po silang karagdagang kailangang contact tracers dahil sila po din ay nagha-hire din, no? Meron doon po silang hiring ng mga contact tracers na ang magbabayad na po ay ang mga local government units ng Metro Manila.
Opo, last na lang po, quick na lang po, Yusek, tanong ni Sweden Velado ng PTV, if mass gathering is no longer allowed under the new resolution, does it also mean reception will also be prohibited for baptism and weddings? Also, are senior citizens still allowed to attend events mentioned?
Yes po, bawal na po lahat ng mass gatherings natin and very clear po ang IATF resolution. Lahat po ng misa ay pinagbabawal na rin natin, no? Lahat po ng mga religious services pinagbabawal po natin. Ang hindi lang po allowed ay ang pinapayagan lang po, no? Pero limitado lang ang numero is yung weddings, no? Binyag at funeral services. Ngunit hanggang 10 lang pong tao. So, ang ibig pong sabihin, the 10 ng yung 10 numero na yun, kasama po ang reception dyan. So, kung sino po ang nag-attend ng wedding services sa mga simbahan man yan or sa kung saan man, ganun din po ang numero sa reception.
Okay, maraming salamat po sa iyong paglilinaw. Undersecretary Jonathan Malaya ng DILG. Stay safe, Yusek.
Maraming salamat din po at mabuhay po kayo.
Samantala na ipamahagi na ang Emergency Housing Assistance Program ng National Housing Authority sa mga biktima ng sunog sa barangay Lapasan, Cagayan de Oro City. Higit 100 benepisyaryo ang nakinabang sa housing assistance na ito mula sa pamahalaan. Panoorin po natin ito.
Sa pakikipagtulungan ng tanggapan ni Senador Go, naibigay na ng National Housing Authority ang pinansyal na tulong mula sa Emergency Housing Assistance Program ng ahensya para sa mga pamilya na naapektuhan ng sunog ang kanilang mga bahay sa Barangay Lapasan, Cagayan